Hello everyone, my name is Brandon Elliott, and I'm going to be doing an informative video over pneumonia. Let's get right into it. Alright, so I used one of the ebooks from Lincoln Land's website over community-acquired pneumonia. It states that pneumonia is an infection in the alveolar space in the lungs with accumulation of inflammatory cells and secretion in the alveoli, resulting in an impaired gas exchange. All right, so I'm going to go into this in a little bit, but that's basically an infection in your lungs affecting breathing and proper respirations, which can affect different parts of the body. All right, so then the most basic definition I could find, lung inflammation caused by bacterial or viral infection in which the air sacs fill with pus and may become hard. The inflammation may affect both lungs, which is double pneumonia, one lung, single pneumonia, or certain lobes, which is lobar pneumonia. All right, and then there's different types of pneumonia. There is nosocomial pneumonia, which is caused during a stay at a hospital, and this can occur up to 1 week or 2 weeks after discharge. There's hospital-acquired pneumonia, which happen after treatment is given, 48 to 72 hours after the treatment has been given. There is ventilator-assisted pneumonia, which is pneumonia that happens while someone is on a ventilator. And this is usually the worst case pneumonia, mostly because it affects the lungs directly, and it pretty much they can't breathe, and the machine that's assisting them is just worsening it. This one's really bad. And then community-acquired pneumonia is the most common. That's just your every average Joe just walking around. It just happens to him. All right, and then here's a picture here. I'm gonna be going over this. So for the anatomy-wise for this, we have the trachea, and then we have two branches of the bronchioles, and this goes into the lungs, and then they split off into these little alveolar sacs. Now these sacs is where gas exchange happens between CO2 and O2, and this goes straight into the bloodstream, and then it's transferred throughout the rest of the body. Now one of the most common comparisons is like whenever someone gets food stuck down the wrong pipe, instead of their esophagus, it's stuck in their trachea, their windpipe. And so whenever we do inhale this virus or infection, it gets trapped in our trachea, travels down into the bronchioles, into our lungs, and then it stops at the alveoli, in which the macrophages, which sole purpose is to essentially defend and fight off infection against viruses such as this. Now, when someone has a weakened immune system, they cannot fight off the infection and are left helpless unless aided by medical staff, of course. Alrighty, and then I'm going to be going into some symptoms for you guys. So one of the ebooks that I used from Lincoln Land's website is Clinical Management of Pneumonia. The signs and symptoms here are fever, cough. Coughing is the most consistent, persisting symptom in bacterial pneumonia, and it can also have weakness and altered mental status accompanying with most pneumonia. Now, this can also be accompanied by fevers, cough, shortness of breath, rapid or shallow breathing. This really, mostly because it targets the lungs, it's going to be affecting your breathing. And then also, if you're experiencing sharp or stabbing pains, this is your body's way of telling you that you need to get help because your body's fighting off infection and it needs aid. So you're going to be really dehydrated in this because your body's fighting this off. You're going to be very fatigued, so lots of rest should be required, and you're just not gonna be at your best. This is also very similar to COVID-19 or the coronavirus that we are seeing Now, so this is a diagram of just some of the symptoms you can be aware of or looking out for in the near future. Alrighty. And then we're going to get on to treatment. So, as I was saying earlier, with the signs and symptoms, the treatment to control a fever would be the best with aspirin or anti-inflammatory drugs. These target the infection and reduce the swelling and really just help with breathing. Drink plenty of fluids, stay away from coughing medications, and stay away from smoke. And you want to get lots of rest. Make sure that your body's at top shape. Recovery and proper prevention. You want to make sure that you have proper rest while you're recovering, and limit contact with family members, as this also spread through mucus exchange and just air in general. And then also chest x-rays can be taken to monitor your lungs. All right, and then some complications that go along with this. These can affect older and younger adults, and also children or someone with a damaged immune system, and people with serious medical conditions. And these are respiratory failure, sepsis, acute respiratory distress syndrome, and lung abscesses. Alrighty, and then one of the other complications here from one of the ebooks, nosocomial pneumonia. It says strategies to prevent VAP, which is ventilator-assisted pneumonia. Focus on reducing the burden of bacterial colonization and aspiration of contaminants. Now, what this is stating is essentially making sure the healthcare workers clean off the ventilator tube properly and making sure that the patient is not inhaling any foreign particles and that is further damaging their lungs. Alrighty, and that is all, folks. And I just want to advise you to stay at home and stay safe during these trying times, and just know the difference between COVID-19 and pneumonia, and essentially just inform you about that. So, hope you guys enjoyed the video. I hope you learned something. Thank you.